Hi, my name is Lucy Allwright and I'm a project manager at AVA, which stands for Against Violence and Abuse.
Hi, I'm Karen Lingwood and I'm the training manager at AVA.
We're here today to talk about the links or how we can improve working between local authorities and the women's sector, and Karen and I are going to have a conversation about our experiences of working for both local authorities and within the women's sector. So just to introduce AVA, AVA is a second tier organisation. That means we don't directly provide frontline services, but we provide a range of training, research and consultancy with the aim of improving responses to survivors and improving services, and we do policy work and lots of evidence-based research to help really improve the sector.
So our role within the second tier strand for the Ascent programme is that we provide 6 days of accredited training, either with a CPD or OCN accreditation. We also across the year deliver 2 seminars and we deliver 1 good practice briefing.
So Karen, can you tell me a little bit about your experiences of working with local authorities?
So yes, I worked with a local authority for around 18 years in various different roles. Predominantly in my early career working directly with families and working with children, young people and women affected by domestic abuse predominantly. And I then moved into more of a managerial role within Children's Services Early Intervention with a focus on leading domestic abuse across the service. And then before I left the local authority, led on the development and delivery of the newly created domestic abuse strategy, which was brought in to try and improve the whole council's response to domestic abuse. So really looking at the response across children's services, adult services, across our commission services through public health, looking at housing response and that the whole spectrum of helping people affected by domestic abuse.
So you've got a really good broad overview of that kind of experience of both providing services but also kind of how you join them up, what it looks like at the strategic level, getting organisations to work together.
Yes, yeah, absolutely.
Brilliant. And I'm just, in terms of my experience, I come from a slightly different background in that I actually work within the women's sector. So I started out on the National Domestic Violence Helpline. I became an independent domestic violence advocate, so I worked kind of trying to support women through the courts and also in the health context in maternity hospitals. I was involved in working with children and young people to support them to get help when they're experiencing abusive relationships but also sexual exploitation. And then I also worked for a local authority. I was involved in implementing a violence against women and girls plan, training, partnership working. So I've kind of got the experience of being in the women's sector and the local authority and knowing what that feels like and how it can work really well, but also sometimes where those things can rub up against each other. I think there's kind of a few things that might potentially get in the way of that partnership working. One is the nature of funding, and competitive tendering can mean that there's a kind of perpetual cycle of trying to get the next contract in, which can be quite difficult. And I think there can also be a sense that you're being asked to provide quite a lot of free labour, you know, the idea, oh, come and sit on this panel or come and inform this or respond to this consultation, that can feel really difficult. I also think that sometimes the nature of contract monitoring can be quite difficult and onerous, so that the outcomes focus can sometimes mean services really start focusing on quantity. What evidence do we have to provide without thinking, well, you know, how are we supporting women here? I think also there is something about an us and them mentality can really get built, and I think there's some, you know, if you don't sit down with someone and have a cup of tea and kind of realise that actually they're tired and they're trying to do their best as well, then that can kind of create really different barriers. And also just not always understanding each other's service cultures, just kind of stepping back and saying, well, what is the women's sector, where does it come from, who's in it, why are they attracted to it, what does that mean? And the same with local authorities, what's interested you about this, why are you working here, what are we doing? And I think understanding each other's service cultures can be really important, because if you don't, those barriers can kind of become insurmountable, and actually that's when people start getting suspicious of each other or start getting angry with each other, and I have seen that happen, and I think so that those can be kind of real difficult barriers for the women's sector, I think. With that in mind, what is there anything you think we could do, women's sector, local authorities, at AVA, across the women's sector, to try and kind of improve things? Are there models out there? Are there ways of working? Are there things that you've kind of seen that you think, actually, if we did this, that could make a real change, and it's tangible?
So the Mapping the Maze work that was looking at women's experiences of multiple disadvantage and looking at what they want, very much came up with a gender responsive and trauma informed approach to services. And when we talk about a trauma informed approach, if local authorities were to commission services that are trauma informed, then we could be confident that the survivors' needs and the survivors' voices would be at the heart of that, because the very nature of being trauma informed means understanding women's experiences, means really ensuring that every service that is commissioned is working under the same ethos and is providing the right environment and providing services in a way that women feel safe and able to access them.
And so the Mapping the Maze work was a piece of research undertaken by AVA and Agenda, which looked at mapping services nationally in England and Wales to see what was available. And again, that identified loads of kind of siloed working and missed opportunities, but it also said, if services work in this way, if they're informed by women's needs and experiences and understanding what's happened to women, then those services can be improved. And actually, working in a trauma-informed way also says staff need training, staff need support, staff need to understand their own responses to the violence and abuse they're hearing about. So it's a as you say, it's a whole ethos and model for working, and it's evidenced, increasingly it's being shown that this is a model of working that's great for women and it's commissionable. It's there as a model.
So if we were going to give, say, 3 key messages about better collaboration, what do you think those should be?
I think in the context of local authorities, valuing and understanding that the women's sector has real expertise and they're desperate to share it, and actually kind of trusting that that expertise can improve services, and it means that survivors will be at the heart of your work. Looking at trauma-informed models and kind of understanding the nature of trauma and looking at how you can fund those services, and also kind of bringing in training to ensure that trauma-informed model works. And I think at the core of both of those takeaways is focusing on relationships. So how do you build relationships between local authorities and the women's sector, formally and crucially informally? So it's not just the one person that knows the person that works in the women's sector. You have coffee mornings, you go into the services, you build relationships, because that's also at the heart of trauma-informed work. It's understanding that your groups of people who are encountering each other and trying to find ways to kind of communicate and talk, and if you don't have good relationships there, then you're not going to have good relationships with the people you're trying to support.